Good evening. Maternity services in Kent and Sussex will be investigated as part of a national rapid review into failings in maternity and neonatal care dating back more than 15 years.
The East Kent Hospitals and University Hospitals Sussex trusts are to be included in the review. It'll aim to give clarity for families who've been asking for answers and suffered bereavement. It's due to reveal its initial findings by the end of the year, but many families are unhappy with both the scope and the timetable. Well, Andy Dickinson joins us now from the Royal Sussex County Hospital in Brighton. And Andy, you've been speaking to some of the families. What are their concerns?
Well, Kit, the hope is to finally drive improvements after a huge range of issues at some of our maternity services dating back more than 15 years. We've spoken to a number of families during that time, some of whom lost their babies due to, they say, preventable mistakes. Among them, Katie Fowler. Her daughter Abigail was starved of oxygen here at the Royal Sussex County Hospital, dying 2 days later. She and her husband believe this inquiry will not be independent enough.
I think we're quite disappointed. We've been involved quite closely with the process of developing the terms of reference over the summer. Unfortunately, a lot of the feedback that we've given alongside other families in Sussex hasn't made it into the final terms of reference. We actually haven't seen the final terms of reference, despite Baroness Amos saying that this was a kind of co-produced investigation. It doesn't feel like that to us.
This national investigation has not included the regulators in the way that we hoped it would. In fact, some of the investigation team are likely to have strong links to some of the regulatory bodies, and to us we feel like that is them marking their own homework.
Well, trying to assuage those fears, Baroness Amos, who will chair this investigation, has laid out why it's going ahead and what she hopes it will achieve.
I have met so many families who are frustrated, traumatised, have been harmed or bereaved by what's been happening in maternity care going back a very, very long time. We've had a series of reviews and recommendations, and what I've been asked to do by the Secretary of State for Health and Social Care, Wes Streeting, is to bring all of those recommendations together to come up with one set of national recommendations which can be implemented.
So Andy, what are the two hospital trusts in our region saying?
Well, the Sussex Trust says it is making improvements. Dr Maggie Davis, its chief nurse, says we welcome the opportunity to take part in this review and we are committed to doing anything we can to help in the effort to improve maternity care across the country. We never lose sight of the fact that some families have suffered devastating losses and our hearts go out to them. East Kent University Hospitals NHS Foundation Trust says it too welcomes the opportunity, and our staff have worked hard alongside families to make significant improvements to our maternity and neonatal services. Maternity services at this hospital here currently rated inadequate, though that was back in December 2021. This, we're told, will be a rapid investigation with initial findings due in December. A final report expected in spring 2026.
OK, Andy Dickinson reporting from Brighton. Thank you.